Did you know that pain can come from more than just trauma, arthritis? It can also come from a broken heart, grief, depression. So let's talk about it. I recently had a patient that came in that was consulted for knee pain and shoulder pain. As the patient comes in, and usually like clockwork, she also complained of hip pain, pretty much all on the same side. And when I asked her what was going on, she had not fallen, she had not had a car accident, had never had any history of arthritis or any other issues. Nothing had really changed in her life, except she had lost her husband in the past couple of weeks. And so she had been lying in bed and not really doing anything. So when I asked her, how long have you been married? The relationship and that kind of stuff. She was madly in love with this man. And the thought of living life without him literally gave her such grief. She was now complaining of some chest pain and some anxiety and some stress and definitely depression, which goes along with grief, but to the point of physical pain is a whole nother level. So in 2012, there was this really interesting article that was done in Denmark that looked at people that were in relationships, whatever that kind of relationship was. It could have been a spouse, could have been a loved one, could have been a parental or child type of relationship. That when that patient had lost that loved one, they were followed for almost 10 years. And the results were stunning when it comes to the grief and what happened. What they found were there were different levels of grief, like severe grief where they couldn't get out of bed, somewhat like my patient, to a moderate that dissipated over time, to low, mild, moderate that was tolerable and they could live. Of note, the ones that were moderate to high or severe died within 10 years at an 88% rate. So, why is this important? Why it's important is two reasons. One is because you need a complete history and physical exam from the patient and really understand more than just if they come in with knee pain or shoulder pain or a bellyache or anything else. You want to know what's going on around them psychosocially, what's going on in their life that may be affecting their actual, physical being. Second, you have to realize that grief and stress, depression, anxiety, all of these things have more than just a mental capacity, not just an emotional capacity. They have a physical capacity that can be devastating to one's human body to the point where joints and musculoskeletal pain can be real and manifest themselves in various ways. So, my take home message here is if you've had a broken heart, if you are grieving, if you have stress or high anxiety, you should definitely talk to someone because you going in for a headache or knee pain or shoulder pain may be more than just musculoskeletal pain.